Did you know that one of the main causes of child death is preterm delivery? Hi, my name is Rachel, and along with my team members Naira and Lung, we researched to see if there had been any new technology to predict preterm delivery to provide quicker management and less child loss. The newest technology for this was elastography of the cervix. This afternoon, we will share with you what we have learned. Preterm deliveries are any deliveries that happen before 37 weeks of gestational age. PTDs are associated with many serious health complications such as delayed development, cerebral palsy, hearing and sight problems, as well as infant mortality. These occur at an increased rate in lower income countries. The prevalence of PTDs are at 8% in Canada and an average of 11% worldwide. There is a link between preterm deliveries and cervix properties. On this map, you can see the areas of higher prevalence of PTDs. Some of the lower income countries have more than 15% prevalence, and in these lower income countries, there is a worse outcome from preterm deliveries for infant mortality. The three properties that pertain to preterm deliveries are the length of the cervix, the dilation, and the firmness. Shorter cervixes are associated with PTDs, as well as open, dilated, or beaking cervixes, and soft cervixes. We'll spend a little bit more time talking about this firmness property due to its association with the rest of our research. So soft cervixes have an important biomechanical property that's important in distinguishing them from hard cervixes. A soft cervix will have an increase in collagenolytic activity, and this will cause a heterogeneous appearance to the tissue and a lower biomechanical strength. And of course, this decrease in strength of the tissue is what makes it a soft cervix at a higher risk of preterm delivery. The tissue change from hard to soft occurs progressively from the internal os to the external os as the pregnancy progresses. It is standard practice to measure the cervix and visualize the internal os. Some limitations seen with these current methods are that the cervix measurement can be underestimated when a one-line caliper is used instead of a two-line measurement, as in the first trimester, the cervix is curved. One of the studies showed a higher rate of preterm deliveries, that being 62.7%, where the cervix was actually measured at greater than 2.5 centimeters, which is the current normal value. Visualization of the internal os can be obscured when trying to tell the dilation, as well as the pressure from the bladder, if the patient has avoided, could close the cervix falsely or look like it's falsely closed. This leaves us with one property of the cervix that isn't included in standard practice for assessing, and that's the firmness. A method that can be used to determine this property is elastography. Elastography assesses the stiffness of a region based on its tissue deformity. The machine color encodes the deformity detected using color maps. For example, red is encoded as soft and blue is encoded as hard, with the variation of color showing the variation of deformity. There are a few different types of elastography. We were focusing on the two main types that were focused on in the research studies. And these two types were strain elastography and shear wave elastography. From this image, we can see what the color encoding may look like, where you can tell which tissue areas are softer or harder based on the color encoding, the red being soft and the blue being hard.
So as mentioned before, the two types of elastography that we mentioned in our paper were elastography through strain and shear wave techniques. The strain technique uses a mechanical displacement to generate the elastograms, and it's very accessible because it basically just needs a specific software system installed to the regular ultrasound machine. However, because of this mechanical component, it's very hard to standardize because each technician might apply a different amount of pressure. And the shear wave technique, it uses acoustic radiation force impulses, which eliminates the dependency of the operator because we don't need this mechanical displacement. However, it does need a specific type of prototype transducer, and it can be affected by the target diameter and even by the stiffness of the surrounding tissue. So some of the findings of the cervix elastography regarding preterm births. It was noted that patients with a soft cervix had 3 times more chance to have a short cervix around 30 weeks of gestational age, even if their cervical length was still normal. And patients were also 1.5 times more likely to have a prior history of preterm delivery when they had soft cervix. And it was also associated to some risk factors such as advanced maternal age and obesity. And even the labor induction results were also associated to the stiffness of the cervix because they noted that patients that responded better or had better outcomes from the induction labor, the labor induction, they actually had soft cervix compared to patients with hard cervix. And it can be a very useful tool to assess the response to progesterone treatment. There was this study that mentioned that lack of improvement in internal and external os elasticity ratios after 1 week of progesterone treatment could progress with cervical softening. And the combination of elastography and the cervical length was more accurate than the cervical length alone that used to be the parameter used to assess the response to the treatment. It seems that the measurement of the internal os is more accurate than the measurement of the external os, and that can be explained by the influence of the pressure applied in the area when performing the elastography, depending on the technique used. And also because some patients that are under vaginal progesterone treatment, the local changes of the medication will affect more the external os than the internal os. So it was recommended to trust more on the measurement of the internal os and also to sample multiple regions because the cervix is such a complex structure. Even though the focus might be the internal os, to take different measurements to have a more accurate result. And the clinical significance of the elastography was more noted with the cervix between 15 to 25 millimeters. And why would that be? Because cervix that had less than 15 millimeters, they already were at higher risk of a preterm delivery because they were already short. And also it was a cervix with advanced biomechanical changes. And the idea is try to find patients that have a normal cervix, but is still a higher risk to result in a preterm delivery. So a very short cervix and doing elastography to that one, the results weren't even accurate and neither added much information. The elastography of the cervix can predict the changes even before length and dilation occur in these patients. And the sensitivity and specificity of the elastography ratios seems to be similar to the cervical length, according to some of the studies. And if the results are so good, why can't we just use it? The main challenge is because there is no standardization related to this method yet. The studies that we reviewed, basically all of them had a different methodology or technique applied. They got a different population sample to assess. And even the phase of assessment differs because some mentioned to do that during the first trimester, some mentioned to do by the time of the regular detailed ultrasound. So, and even to correlate the findings of elastography with other techniques, such as the measurement of the cervical length. Some other studies just assess the elastography alone, so it's very hard to come to a more robust result and recommendation when there is no standardization. So in conclusion, the elastography of the cervix seems to be an effective method of assessing the risk of preterm delivery. The elastography, in conjunction with other methods, seems to have a more accurate evaluation, mainly because it's still not a tool that we can use alone. And the lack of a standardization and limited studies remain to be the main challenge to adopt this technique more frequently. So further research is still required to incorporate this method into the daily sonography practice. These are our references for the paper, and thank you so much for watching.